So good evening everyone, and today we will be discussing about the air crescent sign. So air crescent sign is nothing but a crescent of air which is surrounding the soft tissue mass. For example, here if you will see, you can see a soft tissue, right? You can see a soft tissue over here, and surrounding this soft tissue there is a crescent of air, isn't it? So there is a crescent of air which is surrounding the soft tissue, and this crescent of air, because it is having the shape of crescent, or it is having the shape of half moon like structure, that's why it is called as crescent. So half moon like structure is called as crescent, so that's why it is named as crescent sign. So a crescent sign appears as a crescent of air which is surrounding the soft tissue mass in a cavity, that can be a pulmonary cavity. So it can be appreciated in the X-ray. For example, right now I am showing the crescent sign in the X-ray, and likewise the crescent sign can be appreciated better in the CT scan. For example, if you will look at this particular CT scan, here we can see this pulmonary cavity. This is the cavity. I will use a better color over here. So you can see a better cavity over here, right? And inside the cavity there is a this is the cavity, and inside a cavity you can see there is a air crescent sign. So the thing which you can look over here with the yellow color, right? So this is the crescent shape, isn't it? So that is the air crescent sign in the CT scan, or you can say the HRCT thorax. So air crescent sign can be appreciated in the X-ray also, and can be appreciated in the CT scan as well. So air crescent is actually seen in the periphery of a pulmonary mass usually, right, which is a soft tissue mass. It can be seen in the multiple conditions. For example, it can be seen in the cavitating neoplasm, it can be seen in the lung abscess, or it can be seen in certain infections as well. But you know, this is a good sign for the patient. So this sign is actually considered a good marker of the immune activity, as it is seen when the necrotic tissue gets invaded by the leukocytes, which is replaced by the air in the invasive pulmonary cavity. For example, I will give you the example. First of all, usually there is a consolidation, right? There is a consolidation. This consolidation will further, you know, will be having the necrosis, right? And then that necrotic tissue will be getting invaded by the leukocytes or your WBCs, okay, and then it will be getting replaced by the air, and that's how we are talking about the air crescent sign, right? So then when there is the soft tissue mass surrounding that, the tissue is getting replaced, or the necrosis is getting replaced by the air, that is the air crescent sign. And when you are seeing the air crescent sign in some patient, that is a sign of a good marker of a immune system of that particular patient. It means the patient is recovering. One more example. So this is the CT scan of a patient, because this is looking like a moon, half shaped moon. So here also you can see this is the air crescent sign, right? So this is the crescent shape, and outside that you can see there is a mass, or you can say there is a pulmonary mass, right? So that is the air crescent sign. It can be seen in various conditions, as I told you earlier, and the other condition where it can be seen, that can be pulmonary gangrene, pulmonary hematoma, and there are other conditions as well, like hydrated lung disease, right? So this is about the air crescent sign. Thank you.